what is public health? When people think about it, what should they be thinking about?
It's really interesting. And I think the easiest description of public health that resonates with the mind of people who are not medical is that medicine is really all about treating an individual patient, finding out what's wrong with that patient, and then finding the right treatment option for the patient. In public health, we're really trying to look at populations and what causes diseases in populations so that we can go about preventing those diseases. So if you think about everything that touches a population, public health is in all of those areas. So climate change is one example. Another example is health policy. How do we determine what Medicare pays for or doesn't pay for? That health policy analytics is part of public health. But it's also things like I did in my field, epidemiology. We're studying who's getting the disease, when are they getting it, all of the sort of characteristics of disease and trying to understand the drivers of diseases in populations. So it's a very broad field, and just about any field that you could do as an undergraduate could fit nicely into public health if you have a love of really helping populations. In public health, what we want to look for are what are the enabling factors that allow that person to get the help that they need. So what are the structures that we need to put around that person? Do they need transportation to the hospital? Do they need someone to fill their prescription for them? Do they need food service? Do they need help paying their electric bill? So understanding those determinants of health, like looking at populations, really helps us to cross those bounds from social science to the hard sciences of medicine and try to be that bridge building between those two very different areas. Well, the college is an amazing group of individuals. We've done amazing research, and it's not me, it's the team that we have in place and have brought on. One interesting, fun thing I'm really proud of is, we had really high colon cancer death rates. We still do, but it's getting better. But we had terrible screening rates for colon cancer. We were close to the bottom of all of the states. And now through these programs of screening, we're up to number 2 in terms of screening success in the country. Our rates are number 2 in the country. And now we're going after lung cancer. That's just one example, but we've been so instrumental too in through our Kentucky Injury Prevention Research Center of really honing in on the opioid epidemic. We've partnered with the governor's office to create websites that are updated every 24 hours, Find Help Now, ky.gov, to help people with substance use disorder find a treatment facility and get into treatment when they're ready. There's so many things to be proud of, but I think the thing that is most transforming for me is seeing our students and the amazing things they do in their community when they leave us. So when the past 5 or 6 years has really been about setting a trajectory for the college, being very inwardly facing. We've done a lot of hiring. I think we've hired over 40 faculty since my arrival. And so we've really been building the structure and improve. We've gone through 2 accreditations. So we are now ready. We're launching our next 5-year strategic plan in July. We've been working all year on working through the plan itself. Our goal is to really now move externally to the Commonwealth of Kentucky and beyond, to really be the source of public health knowledge for both local and state public health and other areas, workforce areas in the state, to really be that partner of choice for the Commonwealth of Kentucky.